Alrighty, so today's video is one that I've wanted to make for a while. I've kind of wanted to get into this kind of content where I just throw some background gameplay on and talk about something that I think is sort of ethically interesting or something that makes you really think. And so I'm going to cover a topic of discussion that I feel I'm qualified to speak on due to my experience in emergency medicine. I've been working in emergency medicine for about 4 years at this point. I've been working at a level 2 trauma center for about a year and a half. To sort of give you an example of what that looks like. So just this weekend, I'm trying to think of the most sort of critical patients that I worked directly with. There was a woman who doused herself in lighter fluid and lit herself on fire because she wanted to kill herself. So she charred basically 70% of her skin off, and that was just, she's alive, but that's very sad. Similarly, there was another suicide attempt, a guy who had a wife and a kid, but ended up blasting a bullet through his face, and he didn't die though, just kind of hit some of his brain, so he'll be fucked for the rest of his life. And so that's also pretty tragic. Had a guy who got stabbed by his stepdad in the face, and then there was a cardiac arrest that I worked as well. And then there's also things like, this didn't happen this weekend, but like a dude who got shot in the butt by a harpoon. And so I'll throw up the x-ray of that on screen. Anyways, anything from heart attacks to strokes to car accidents, I'll throw up a picture of a teenage kid who got in a car accident, who had his head split open. That I think is pretty interesting. I was actually talking to him a lot. He's a nice kid. So what I want to talk about today has a lot to do with the concept of cardiac arrest, and it's pretty much, what does it mean to be alive is the question. And it's very opinionated. It's something I'm asking metaphorically, or I guess rhetorically would be the correct term, but I'm also asking literally for y'all, like what your opinions are. And to kind of elaborate on the question, I'm going to paint you a picture. So from a medical standpoint, we consider being alive as being able to maintain your own pulse on your own. That means we're not performing mechanical compressions or CPR. And so pretty much having a pulse is enough for us to be like, okay, you're alive. And with emergency medicine, there are a lot of things we can do to keep you alive. So let's say let's even say that you weren't alive and we started CPR and we started beating your heart for you. Similar to the fact that we can do what the heart does, but mechanically, we can intubate and put a tube down your trachea and breathe for you if your breathing stops. If your kidneys stop working, you can start taking dialysis. There's lots of things that we can do in the medical field that circumvent a shortcoming of the body. So, having a pulse is the technical medical term of or understanding of being alive. And so the question I'm kind of asking today is not from the medical concept, but from the human being perspective. So I have worked with more patients than I can currently remember that have been quote unquote alive, have had a pulse, but have had such low quality of life that I'm nearly certain if they had the ability to communicate it to me that they wanted to die, they would say so. So for example, you go into the patient's room because they need some lab work drawn, and they are completely paralyzed. They cannot talk, they cannot move, eyes wide open, staring at the ceiling, mouth wide open, immobile. And you communicate to them that, hey, I'm going to be starting an IV on you just to get some lab work, okay? Put the tourniquet on, quick poke, 1, 2, 3, poke. No movement of their arm whatsoever. Very likely that they couldn't even experience the afferent neurons returning to their brain to communicate the pain signal. And but they're still alive because they have a pulse and they're breathing. So I guess that's a life worth living. Well, I disagree. I don't think so. Similarly, I'm gonna throw up a CT scan of it was a patient who had a past stroke, and it pretty much, like a California wildfire, just incinerated half of his brain. And so, but didn't kill him, didn't make his brainstem non-functional, which is the part that works your autonomic functions. So still alive, but won't really ever be moving or doing anything of substance. Excuse me, or experiencing much of anything. So once again, like, they're alive, quote unquote, but are they actually? So there's that. I'll get into what I deem to be being alive in a minute, but I just want to cover all my bases first before I dive into my opinions. So another thing as it relates is the concept of CPR, working cardiac arrests, and codes. So think of cardiac arrest as like, if your heart stops, there's a reason it stopped. So in the medical field, we will beat your heart for you doing CPR, and we will place a tube down your throat and breathe for you, and we will dump epinephrine into your veins and other antiarrhythmic drugs. Epinephrine's not an antiarrhythmic, but like we'll dump antiarrhythmics into you and probably some fluids and shock you in case the electrical conduction system is what's all malfunctioning, and we'll troubleshoot a bunch of things that might have caused you to go into cardiac arrest. And then hopefully once we fix whatever caused your cardiac arrest, then your heart will be able to get ROSC and be able to beat on its own, and then hopefully you can make a meaningful recovery. That's the hope with resuscitation, is that we alter whatever was wrong, and then you're able to return to life. That's the idea. So now I want to paint a picture of a 95-year-old who has cancer and weighs like 80 pounds, like 80-year-old woman or 95-year-old woman who weighs like 80 pounds, and we are shattering her ribs and, probably giving her pneumonia with the whole process of the intubation and everything, and dumping loads of adrenaline into her veins, etc., etc. Say that we get her back. Say that we get ROSC and we get a pulse back. She is still 95. She still has cancer. Everything we've done is her ribs will still be cracked. She is not going to make a meaningful recovery. There's maybe a 0.0001 chance, but it's not happening. You know what I mean? And for me, that feels like violating, like we're violating some sort of sacred law to a point. Like, this woman just died. She's 95. And now we are shattering her skeletal structure, dropping a tube down her throat. We're punching needles in her veins and maybe even drilling into her bone to give meds. And like, she's 95. Let the lady die to a point. But, we're liable. We're medical providers. We can't be biased. We can't say, hey, I don't think we should be doing this. If a family wants CPR or if there's not a DNR, it's what we have to do, because we can lose our livelihood by withholding care from certain people. That's obviously could be considered discrimination or any variety of things. So we can't do that. And not saying that the discretion should be up to the medical provider of whether or not to resuscitate or not. But it's also challenging because the patient is not alive to tell you what they want. So if we can't get a living will or DNR, like if that doesn't exist, it's kind of hard. It's a tough territory to navigate. So with that being said, all those things, my thoughts on what it means to be alive. So for me, I'm just going to think about how I would consider it for myself. I would say being able to communicate in some fashion. not necessarily audibly being able to speak, but being able to communicate in some meaningful fashion. Being able to think and understand things is a big one for me. So the ability to think and have and a lot of these things I'm going to say are like human things. Like, yes, birds can understand each other, but like, I mean, like, well, I guess the understanding thing is not purely human, but critical thinking, like being able to think, I think that's a big one for me. Being able to move in some fashion, that's a big one for me as well. So like, if I can't get up and move or roll over or move my arm to change a channel or move my face to look over at a TV to watch a show that I like, that's a big one for me. So I have to be able to think, I have to be able to communicate in some way, I have to be able to move in some way, and I have to be able to enjoy something. Like, I have to have something that whether it's consuming a form of media, whether it's playing a video game, whether it's even just communicating or talking with family, I have to be able to enjoy something. And those are kind of my pillars. I didn't really take them too in depth, but like, still have that ability to be human and, you know, communicate and move and exist to some degree in society. I don't want to be just pooping my pants every day, unable to communicate that I have done so, almost like infantile in nature, unable to say I can't even wipe my own rear end, and I can't even really chew food or eat, and all these things where I just can't. I'm not even living. I'm alive, but I'm not living. That's the big thing, is the distinction between what it means to be alive and actually living. So that's kind of my thoughts on that. I'm really curious to hear what you guys think about that, whether or not you're familiar with the concept of resuscitation and the kinds of patients that we see in an emergency setting a lot. It's tough. A lot of these people, if you're empathetic at all, you think, man, I would not want to live like that at all. Like, here's another example. In EMS, a lot of times, I've gone to a couple, but this is a lot of the reason that I stopped going out and working in the field was because you go to a rundown house where, like, you find a patient laying on the ground, covered in their own fecal matter for probably a week, can't move, pretty much rotting there, soaked in their own urine, and they have no one to take care of, or to take care of them. And you bring them into the hospital, and I'm like pretty much just citing a patient that I had, and they're pretty much just moaning there. Maybe they're just screaming, and like, you clean them up, but they can't talk to you, and they can't move on their own, and you move them from one stretcher to the next, and they're screaming when you do so. And their arms, like, you go to extend their arm for an IV, and they're like pulling in, like extending their arm just hurts them. It's like, man, you're not living. I bet if you had the faculty, the ability to communicate that you're ready to go, you would scream and yell, Evan, please just fucking kill me. I genuinely see these patients sometimes, and I'm like, man, what am I doing? You are not living. And that's tough for me sometimes. And so, yeah, once again, I'm just curious what you guys think about that and that kind of concept. I think I had one more point to cover on this topic, and that's sort of voluntary suicide. So suicide is, I mean, we say suicide's an epidemic, but truly it is. I mean, the number of suicidal patients that I've seen and honestly see on a weekly basis is uncanny. Everybody wants to die right now. And that on its own, that's another video I want to make is talking about why. But I want to speak purely on the concept of whether or not voluntary suicide or voluntary death, pretty much, like someone who's ready to die and wants to die, if that should be allowed at any point in life. So, for example, say you have terminal illness and you're never going to recover, and say you'll never be able to move again, or say like you have like a neurodegenerative disorder, or say you're Alzheimer's and it's getting worse and you're losing all your faculties, and soon you're just going to be a husk of who you were, and you won't remember anyone you know or anyone you've ever known. You won't remember any of your family members' names. You won't know where you are. You won't be able to move. Slowly, you won't be able to talk or communicate. Your brain will just rot from the outside in. Say you have any of these potential disorders. Or say you're 80 years old and all of your friends have died, your wife's dead, your kids died in a car accident, and you're retired and you don't have a whole lot of money, you're just kind of living. And say you're like, hey, I'm ready to go. I want to go be with my wife and kids. Those examples, and there's more. I think that to a certain point, someone should be allowed to make that decision. And that's a tough thing to say, because if you look at it from the other lens, you think of children who are suicidal. Say a kid who's like, hey, my parents abuse me and I have no friends, and I'm so out of shape and I don't like myself. I don't like how I look. I'm not passionate about anything. I don't enjoy doing anything. I just want to die. And there's a lot of kids like that. And those are always tough. But they're young, and the likelihood that they could find something worth living for is very high. And we place a very high value on life. Everyone does. And so we're not just going to go, all right, well, sounds fair enough. You got nothing to live for? All right, cool. Here's the correct dose of meds. Like, that would never happen. We would never let that happen, because that child hasn't lived enough life yet to be able to make that decision. At least that's what we think. That's what we all agree on as a society. It seems, though, however, that we've also agreed as a society that someone who's 30 hasn't lived enough life to make that decision. Someone who's 40, 50, 60 hasn't lived enough life to be able to say, hey, I'm ready to go. I'm done. And I wonder if maybe that's something that people should be able to do. I wonder. I don't know how strongly I feel about it. I do think in certain circumstances you should be able to say that you're done, that you're ready to go. And only a couple states, I think, even allow medically assisted suicide. But I just think it's an interesting concept. Some people believe there's like a religious perspective that believes the earth is suffering and you will pass when it's your time to pass, and to do it by your own volition is not really permittable. And so I don't think we should really think about using that perspective as a means of analyzing this concept, but to each their own. I can understand the idea, but I don't necessarily agree with it. So anyways, not the most fun video to talk about, but something I don't want this to be like Debbie Downer, like, wow, what a depressing video. I just want it to be thought-provoking. Like, think to yourself how far you would have to go before you would not want to live out the rest of your life. What debilitations would you have to undergo to reach that point is, I guess, the question. And I guess, how much value do you put on a pulse? and your blood flowing, how much value do you put on that? Versus how much do you how much value do you put on the things that make us human and the ability to communicate and exist and laugh and eat food that you enjoy and watch shows that you like and do things and be passionate about things and share emotions with other people. I hold those things paramount. And so, not to say that I would want to suicide, but like if I reached a certain stage of my life where I couldn't do anything, I would prefer if my loved ones would find a way to let me go peacefully and not have to suffer for years. So anyways, hope you guys enjoyed, or at least not necessarily enjoyed, but hopefully this made you think a little bit. Hopefully you were able to like just put this on in the background and listen to it. And I'm going to try and make more videos like this where I kind of talk about things. I might talk more about emergency medicine, maybe stories that I have that are fun, or maybe not fun. Maybe to you they're gruesome and horrific, but you know, whatever. And I also want to talk about other things that are completely unrelated to emergency medicine. So that's kind of where I'm at. I hope you guys were able to have a bit of an ethical conundrum through this, and I hope you have a great rest of your late night / day whenever you're listening to this. So bye.